Hello everyone, it's your girl Angela here, and in this video we're going to be talking about how I became a registered medical assistant. I do have a friend here. She's wearing my crochet piece that I made a couple months ago. I haven't made any new ones recently, but she will be joining us this video. But anyway, like I said, in this video, we're going to be talking about how I became a registered medical assistant. We're going to talk about the process, which education I got, how I got my certification, my externship. We're just going to go through the process, and then I'm just going to add in, a couple of personal opinions that I have regarding becoming a registered medical assistant. But before we get started, if you can please like, comment, share this video, make sure you subscribe if you want more videos in regards to becoming a medical assistant, and if you would like to follow me on my journey to becoming a registered nurse. To become a medical assistant, there are a couple of different routes you can take. You can get your diploma. Getting your diploma or a certificate in medical assisting can last anywhere between 6 to 8 months, I believe. Although I did not go that route, I ended up getting my associate's degree in applied science along with my medical assistant certification. Associate's degree in applied science along with my medical assistant certification. That was personally my decision. I had the option of becoming a LPN or medical assistant. Guys, I did want to do the LPN program. I did not want to do the medical assistant program, but just because of my schedule at the time, the LPN program just wasn't gonna work for me. For the LPN program, I was going to have to be at school from 9 a.m. to 5 p.m. Monday through Friday. And as far as the medical assistant program, I would only have to come to school Monday through Thursday, and then the hours was from 8 a.m. to 1 p.m. So at that time, the medical assistant program sounded appealing to me because it went along with my schedule and it would still get my foot in the door in the medical field, and that is something that I wanted to do. So since I got my associate's degree, it took about 15 months to get my associate's degree in applied science. I did get some of my general education classes, and then the reason I put at the end of the title of this video pre-nursing student is because from the associate's degree that I got, some of the classes did not transfer over. So an example of this was my human anatomy and physiology did not transfer over. So I will actually be taking my first human anatomy and physiology again next semester coming up in August. So I'm really excited about that. If you guys would like another video in regards to my nursing classes and the nursing prerequisites that I need in order to apply to the RN program. So with my program, getting the associate's degree, we were required to complete a 182-hour externship. That was a very intense experience for me. I learned so much on my externship, and I honestly believe that I underestimated what medical assistants did and what medical assisting was. I'm like, oh, we do vitals, we do this, we do that. But y'all, when I got on my externship, I learned very quickly that medical assistants are literally medical assistants. You are there to assist and help the provider. Everything that provider needs you to do, they need it. Whether it's a he or a she, they need you on it. They need you refilling medications that can be refilled by you. They need you to remind them to refill medications. They need you to communicate with different pharmacies. Sorry if it looks a little different, y'all. I ended up getting a phone call. But anyways, as I was saying, the provider, you are there to assist the provider. Whatever that provider needs, they need you to be on top of everything. They need to make sure you're faxing everything over that needs to be faxed. You need to, whatever needs to be communicated with different organizations, pharmacies, other providers, making sure you're calling the patients back, making sure you're giving the patients their results, making sure you're properly rescheduling appointments, canceling appointments, anything that provider needs, they need you to be on it. So coming into this field, I guess I kind of underestimated what medical assistants do, and I was just taken aback. When I first started on my externship, I was highly overwhelmed, and but I did gain a lot of skills, and I got to learn exactly what medical assistants were and what their role is when it comes to working with providers and just healthcare. So y'all, fortunately and unfortunately, I just took my medical assistant certification exam not too long ago. But one thing I do appreciate about the school that I attended is that they dedicated one class to registered medical assistant exam prep. So they have one class specifically for preparing the students to take their registered medical assistant exam for their certification. So that's one thing that I can say I thoroughly enjoyed about my school. And y'all, let me say this. If your school offers that type of program, or if they offer that type of class or medical assistant exam prep, please take advantage of it, because don't be like me. Because I waited until more than 6 months after I graduated to take my RMA exam. I should not have done that, and I wouldn't encourage anyone to do that. And I think the reason I did that is because I got so comfortable. I did end up getting hired from my externship site after the medical assistant that trained me. She actually put her two weeks notice in. So the provider needed someone who was familiar and who had been trained properly, to take her spot. And she was like, why not? Let me hire you. You're doing a good job. I appreciate you. And so she did hire me at the externship site. And because of that, I just kind of got comfortable. I kept pushing it off. I'm like, I'll just do it later. I don't need, to do it. So I was making excuses to not sit for it. Although I didn't end up staying at that practice. My externship site, by the way, was a primary care practice, and it was one physician. It was a private primary care facility or a practice. And I did not end up staying. I think I worked at that practice for about 4 months, and then I ended up quitting just because it wasn't the place for me. It wasn't anything necessarily wrong with that practice. It just wasn't for me. And I just knew I wanted to be in a bigger organization. I wanted to work with more providers, maybe a different specialty. And so I ended up leaving that practice. But y'all, tell me why I ended up applying to another facility and they hired me without me being certified or without me having a certification. But I do want you all, upcoming medical assistant students, to understand that you get what you get. The quality of the facility that you work at is going to care whether you are certified or not certified. And don't get me wrong, I enjoyed working at the other facility as well. I learned so much. At the new facility that I worked at previously, I was able to get my hands on experience with phlebotomy, as opposed to where I did my externship site at. They actually had a phlebotomist in-house. And although I got a little bit of experience, it wasn't my primary concern, because we actually had an in-house phlebotomist do our lab, draw our blood, and send them off. Whereas at my other facility that I worked at, I was able to get hands-on experience with phlebotomy, and everything just started making sense. So that is one thing that I really appreciate that I learned from the other facility. As far as phlebotomy, things wasn't making sense the way it needed to be making sense when I was in school. So I will say some things that don't make sense when you're a medical assistant school will make sense when you're actually on the job, because once I actually had the tubes in my hand and I actually understood why things was the way they was, so yeah, as far as your certification, I will always recommend upcoming students, if you have a facility that is going to a program that's going to allow you to review and they want you to go ahead and take your exam, please go ahead and take that exam then, so you can get it over with. Because I know there's a lot of talk in the medical assistant community in regards to certified medical assistant, associate's degree medical assistants not necessarily having a difference in pay. And I'm not so sure that I agree with that, just because if you're a medical assistant and you want to work for a more prominent organization or a healthcare organization, they are going to require that you have your CPR certification, you are a certified medical assistant, and they're going to verify it. And if you cannot provide that information, some of these organizations and facilities and employers will not hire you because they don't want uncertified medical professionals working for them. Or that might not be the case, but let's just say you have one medical assistant who is certified and you come in there, yeah, you may have the experience, you're not certified. They may pick that person over you and they may pay that person more. And so with my own personal goals and the goals that I'm trying to achieve in my healthcare career throughout my lifetime, I knew that I just needed to go ahead and get it over with. And I just want, when I'm going on interviews and employers are interviewing me, I don't want my qualifications to have me second guess myself. I don't want, when I walk out of that interview, I don't want to think, is it because of my qualifications? And let's just say I didn't get the job. I don't want them to think it's because, I don't want to think it's because of my qualifications. I want it to be the employer just feels that I'm not a good fit for their facility or organization, whatever the case may be, and leave it at that. Because sometimes I may not be a good fit for them, they may not be a good fit for me. But I don't ever want to walk out of an interview feeling like it's because I'm not registered. So like I said, there are facilities around here, or there are some healthcare organizations around here to where they are not going to hire unqualified or unregistered or certified medical assistants because they like to uphold the standards and qualities of their healthcare organization. And as a medical assistant, I respect that. Especially if you want to work in a quality healthcare facility, they are going to make sure that their patients are taken care of, and they want registered, qualified healthcare professionals taking care of the patients. So next, how did I study and prepare to sit for my RMA exam? Y'all, I used AMT. I bought 2 practice tests. Well, actually I bought 4 practice tests because 2 practice tests come when you buy like the practice test bundle or whatever the case may be. You will spend $30. So altogether it was $60, and I bought 4 of them. And what I would do is I would take a practice test and go over all the questions that I got wrong. And the good thing about AMT is they do give you the rationale as to why you got the question wrong. So that is something that I do appreciate about AMT. But I'm gonna be honest, y'all, I can't say it did not help me because I passed the RMA with the 73. You need a 70% to pass. I passed with a 73. So I just made it over the little hump that you needed to pass. And I'm not gonna say they didn't help me, but let me just say, when I took this exam, y'all, by the end of that exam, I did not think I was going to pass because some of the stuff I just felt like I did not know. And I would be like, I'm gonna just go with this, you know what I mean? Because I don't know, So always, I would say if you have, that's why I always say, if you're in one of those medical assistant programs where they're going over it and it's still fresh in your mind, go ahead and take it and get it over with. So you don't have to be like me and be hoping that you passed it. Thankfully I did, but you don't want to go through that. And so I took all 4 of them. By the 4th exam, I was in the 90s. I was closer to 100%, whereas my first test, y'all, so that's why I said they did help me, but whereas my first test, I was in the 50s. So that is a difference. And I would not take another practice test until I went over all the questions I got wrong and right, and I went over the rationale, and I kind of just looked over it, I studied it. And yeah, I think I spent about 2 weeks studying for the RMA. So I am officially registered at this point. I have a couple months of experience under my belt, almost a year under my belt, and I appreciate that. I had a couple of interviews this week, and one in a particular specialty that I am ecstatic about. I love it. The office was gorgeous. Like, that facility is my personality. So I'm really hoping I get the job, and hopefully I'll update you guys on that, and I can let you know where it is. Well, not where it is, but what type of specialty it is and what type of facility it is, because it is a specialty clinic that I'm talking about, but I won't say where, obviously, for privacy reasons. But yeah, that is basically just an overview of everything that I've done in my journey to becoming a medical assistant. And I've just, throughout this journey, like, I've learned so much. I've challenged myself. I never thought, if you would have asked me a couple years ago, you know. But yeah, that is pretty much the gist on me becoming a medical assistant. And like I said, I'm so excited for the future and what my future holds. If you guys want a video on how I'm currently studying for the TEAS test, how I'm preparing for my human anatomy and physiology class, what resources I'm using, because I'm definitely using a lot of resources to prepare me for this TEAS exam and just to get prepared for my first human anatomy and physiology class. If you guys would like any videos in regards to that, or if you guys have any other questions in regards to me being a medical assistant, as far as my experience and everything like that, I would be more than happy to make another video. So I think that's going to be it for now. I will definitely update you guys. If I do get the job, I'm definitely going to update you guys and let you know exactly what specialty and what I'll be doing. And yeah, so thank you so much for watching this video and joining me and listening to me and getting informed on a little bit about my journey. And I will catch you all in the next one.